Hi friends, welcome to V-Zone Fitness Academy's Human Body and Movement Science educational video series. Today's topic is joint motion or joint movements. In our last Tuesday's video, we have discussed and learned about the planes of motion and the axis with suitable examples. Now, let us discuss about what is a joint. A joint is an articulation of two or more bones. The movements that occur along each of the planes of motion and the corresponding axis, they have unique names. The movement that occur on the sagittal plane around the frontal axis are flexion and extension. The flexion describes movement on the sagittal plane that decreases the angle between the articulating bones, and extension describes the movement on the sagittal plane where the angle between the articulating bones increases. For example, take my entire arm. When I move my forearm towards my upper arm, the angle between the forearm and the upper arm decreases at the elbow joint, which is flexion. Likewise, when I move my forearm away from my upper arm, the angle between these two bones increases, which is extension. These movements occur in various joints. Now, the motions that occur on the frontal plane around the sagittal axis are called abduction and adduction. Abduction occurs when an extremity or part of extremity, which can be our hand or foot, is moved away from the center or midline of our body. And adduction describes when an extremity or part of extremity is moved towards the midline of the body. For example, when I move my entire arm away from the center of my body or midline of my body, this movement at the shoulder joint is called abduction. And when I move my arm towards the midline of the body, this movement at the shoulder joint is called adduction. Remember, anatomical position is always the starting point when describing relative position and movement. Therefore, abducting the hand describing bending the wrist towards the thumb, and adducting the hand describes bending the wrist towards the pinky finger. Finally, motions that occur on the transverse plane along the longitudinal axis are called rotation. This rotational movement in the transverse plane, which occur in our trunk, are differentiated as a right rotation and left rotation, right rotation and left rotation. While these movements in the extremities, arms and the legs, are termed as internal rotation and external rotation. Internal rotation describes it's a turning motion towards the midline, and external rotation describes turning motion away from the midline of the body. And these same motions are called medial rotation and lateral rotation. Medial means inside, lateral means outside. There are some specialty motion exists at several locations in the human body, including the scapula. At the scapulothoracic joint, we can perform or we can do elevation and depression. Elevation is lifting the scapula up. Depression is lowering the scapula. And we can perform scapular adduction and scapular abduction. In the scapular adduction, we can call it retraction, scapular retraction. And in the scapular abduction, we can call it scapular protraction. At the scapula, we can perform upward rotation and downward rotation, where after flexing your shoulder to 100 degree, when you lift your arm up to 180 degree, you can experience or feel that your scapula is upwardly rotating. Likewise, when you bring your arm back to 100 degree, you can feel that your scapula is downwardly rotating. In our forearm, we can perform supination and pronation in the radio-ulnar joint. Supination is when the hand is facing the ceiling, and pronation is when the hand is facing the floor. Going down at the ankle joint or talocrural joint, we can perform dorsiflexion and plantar flexion. This is dorsiflexion, that means the upper surface of the foot lifted towards the tibia or your shin bone, and plantar flexion is the sole or the plantar area of the foot is moved away from the tibia or your shin bone. Going down in the foot joint or scapular joint, we can perform inversion and eversion. Inversion is when the plantar part is lifted medially, and eversion is when the plantar part is lifted laterally. I hope you guys like this video. Thank you for your attention. See you all on next Friday with an amazing exercise science topic. Remember to like, share and subscribe my YouTube channel, Vipin Chandrasekharan.